Well, I have a unique role. I did my training here, so I did my residency here, and then I decided that I want to take care of critically ill patients a little bit more. So I'm doing a 2-year critical care fellowship, and I'm also doing an ultrasound fellowship. Both of those passions, taking care of critical ill patients and ultrasound, stem from the emergency department, and I get to use them in another capacity, doing ultrasound and in the ICU. But when I'm downstairs, I get to pay a little bit more attention to patients that are critically ill and get to use the ultrasound. And so my role downstairs as a fellow right now, I do some electives downstairs where I'm able to help teach residents how to use the ultrasound machine and get to supervise them when they're taking care of critically ill patients. Training has been excellent. So it's a 4-year program here, the training that I've received, and I decided to stay on. We do a lot of work in the emergency department, and then for the critical care portion of it, it's a 2-year program if you're EM trained, which is wonderful because you get to do some surgical training as well as some medical training. And then for the ultrasound portion of what I'm doing, I do most of that in the emergency department, and it's just a matter of just getting exposure to a breadth and depth of patient populations and complexities. I can laugh at so many stories of interactions that I've had with some of my attendings, and those interactions with these mentors leave a mark on you as a trainee and you when you then become the trainer almost. The people here are wonderful. They're very approachable. And, that's why I chose emergency medicine. I knew my personality. I'm very free-spirited. I'm very happy. I like to work hard, and I like to, enjoy what I do. And the people that I work around, my attendings, the staff, everybody's very happy. They enjoy taking care of patients, and we just want to provide good care for the patients. And so I've gotten excellent training here. The mentorship is wonderful. And they've, when I'm in the ICU, I'll come downstairs in the ER and be like, let me tell you about a case. Let me tell you about a patient encounter that I had. What do you think about it? Because that's my core, that's my home, that's my background. Absolutely. I mean, research is what tells you what's kind of current and what is the best way to do something. And even since I've been here, the data coming from researchers is changing the way that we practice medicine. And it absolutely influences how we do what we do. I applied, and it's a match program, and it was my top choice. I was excited. I was training in Pittsburgh at the time, and I just wanted a little bit warmer weather, so I was very excited to be able to come to St. Louis. My family's in Florida, and then I went to Pittsburgh, which is very cold, and St. Louis is a perfect neutral. So you get all 4 seasons. It's hot, and it's also a little cool, but not bad at all. It's a nice, easy town. It's very affordable, especially on a fellow salary, resident salary. It's a small town feel, and it's got a lot of stuff going on, and there's a lot of things available. It just depends on what you're into and where you want to go. In terms of doing it here, I think that if you wanted to do your training here, you are going to get solid education. I feel very good about the education I've gotten here. I feel so good about it that I wanted to continue here, and I'm strongly considering staying here when I'm done as well. I don't know. It's a great place, and I think it has a lot to do with the people that are here for sure. I mean, if you take the hospital, you take the town, it's great everywhere else. But I think it's the people here that really make it what it is here at Barnes and at Washington University. I've had a lot of great encounters, and I just think that you have to come here to experience it. And what happens is when people come, they stay. It's hard for them to leave. It's just very comfortable, and there's no way to experience it but to be here.